video, I'm going to go over how to perform an internal myofascial release technique on your layer 1 pelvic floor muscles. A really quick review on what is layer 1 of your pelvic floor muscles. So what you see here, this muscle here, is called the bulbocavernosus muscle. That is layer 1. That could be accessed if you are doing a external labial fascial release technique, or it could be accessed internally, and I'll show you that shortly. Layer 1 also includes the perineal body and the extending structures to the right and to the left, the STP, the superficial transverse perineal muscle, as well as this muscle here. This is called the ischiocavernosus muscle. Each of these muscles play a role in sexual dysfunction. So the ischiocavernosus can impact your urgency response, so making it feel like you have to pee during sex. It can affect your orgasm. It could be painful. It could be hard to achieve. And it could also impact just general groin pain in the area. The bulbocavernosus, this muscle that helps stabilize or keep shape of the vaginal canal, can also create or be a reason why you have pain during sex, particularly insertional pain when anything is penetrating into the vaginal canal. And then insertional pain can also be the result of the perineal body, the STP. So how we're going to do this is we're going to take our thumb and make sure your nails are short. You're going to take your thumb and you're going to turn it this way. You're going to insert about 1/2 of a knuckle into the vaginal canal. So in this model, this is called the introitus, or the opening of the vaginal canal. You're going to find the opening and you're going to insert 1/2 of your first knuckle. So this is my whole knuckle. You're going to insert 1/2 of it to 12 o'clock. So 12 o'clock is going to be towards the anus. 1 o'clock is going, or 6 o'clock is towards my bladder and urethra, or the clitoris. So find 12 o'clock, insert your thumb, 1/2 your thumb, sink down into the tissue until you feel a gentle pushback. Hold the depth for where you feel like a mild to a moderate stretch, and wait. This is a perineum release internally. Now, the reason why we didn't go all out and just show you on a human model is because there's not much to see. Literally, you're going to see 1/2 my thumb missing, or 1/2 my first knuckle of my thumb missing, and that's it. It's more of a feel. So you hold this position. As you doing this technique, you want to make sure you're set up appropriately. Hips are supported by pillows. You have a wedge or pillows to support you up, or if you're standing, you have a comfortable spot to put your legs so you can get into this position without straining. So this is a spot, the perineum. If we just go off to the right just a little bit, or off to the left just a little bit, we're going to be on the superficial transverse perineum muscle on that side. You repeat the same thing. You sink in until you feel pushback. Now, if it's not tight, you don't have to spend time here, but this is generally pretty tight on people with sexual dysfunction. So you're just gonna wait. Once the tissue softens or heats up, you just wait. And as it softens, you follow it. Minimum time generally is going to be, with internal work, is going to be 2 minutes, but you do want to work your way up to 5. The next spot is going to be the bulbocavernosus. So basically you stay where you are. You might release the tension or the stretch onto the perineum and the STP, and you're just going to translate your hand sideways. So the side of your thumb is coming up in contact with the bulbocavernosus. You find a little bit of pressure or until you feel resistance into that tissue, and you wait 2 to 5 minutes.
So they are going to be going basically, real quick, so if this bottom lip was initially where they started, now they're just going to be kind of going up and off to the side that way, or up and off to the side that way.
Correct. Now, I talked about the ischiocavernosus. This muscle is most easily treated with your index finger. So what you'll do is you'll take your index finger and you're going to insert your finger vaginally, and you're going to find, remember the clock I mentioned? 6 o'clock is the clitoris. You're going to find somewhere between 4 and 5 o'clock. And so you insert about half of or a full knuckle and orient your finger internally like this to the ischiocavernosus or to 4 to 5 o'clock. How you know you're on this muscle and how you know you're on the bulbocavernosus muscle, if you go back to the do-it-yourself pelvic floor exam, is you can do a gentle pelvic floor contraction, thinking about your beans, so gently contract the beans, and you should feel a light contraction underneath your finger. If there's a lot of weakness there, you may not feel anything. I would say I do quite a bit of stretching here. I don't have my patients do as much stretching here on their own as I do down here, but this can be a spot that is significantly tight on people, particularly anyone that had any tearing up here or who've had a lot of vulvar trauma from falls or from other things that can happen, and then also with scarring in the lower abdomen can create restrictions that affects this area. So in this video, we went over internal myofascial release to the perineum or perineal body, the STP, the bulbocavernosus, and the ischiocavernosus. Remember, be gentle, but not too light. Be patient, be present so you can feel whether the tissues heat up and they release so you can follow them, and then pay attention if you notice any excessive discomforts anywhere. As a recap, we went over using your thumb, perineal body, straight down. That's going to be 12 o'clock. Just off to the right, just off to the left, that's going to be 11 and 1 o'clock. Those are your STPs. Then we went over the bulbocavernosus. You're going to ease off 12 o'clock and you're going to go to 3 o'clock for the right side, and you're going to go to 9 o'clock for the left side. And your thumb is, you're just translating laterally. Then you're going to switch fingers. Thumb or the palmar side up, you're going to go towards 4 to 5 o'clock. Just inside the first knuckle, that's going to be your ischiocavernosus on your right. To reach the left side is you're looking for 7 o'clock to 8 o'clock, just inside that first knuckle. To confirm whether you're on these muscles, you can contract your pelvic floor muscles. Think of the beans from the exam, and you should feel a light contraction. If those muscles are weak or they're inhibited, meaning they're not functioning optimally, you may not feel anything, and that's okay. If you feel too much discomfort, ease up. It doesn't have to be forceful, and what you should notice is as you hold, the discomfort eases. If it gets worse, that is an indication that spot is a bit too angry. Reach out or see your pelvic floor physical therapist.